Hello, I'm Dr. Paige Lacy. I'm presenting today on our work on asbestos-related lung diseases in industrial workers that have been exposed to asbestos and other materials during their work as insulators. In this work, we've discovered that occupational exposure to hazardous substances such as asbestos is common amongst insulators, and this has occurred despite the ban of asbestos from use in construction since the 1990s, and workers are still getting exposed to asbestos as well as many other particulate hazards such as aerosols, calcium silicate, carbon fibers, fiberglass, mineral fibers, and refractory ceramic fibers. Although exposure to non-asbestos containing materials may cause potential health effects, whether they are associated with ARLDS remains undetermined. So the objective of our study was to investigate whether occupational exposure to non-asbestos particles was associated with asbestos-related lung disease, ARLDs, among insulators who reported exposure to these materials, including asbestos. The way we set up this study was that we carried out a longitudinal analysis of baseline and follow-up data of unionized insulators that were enrolled in the Wellness of Workers program in Alberta in Canada. We screened 984 insulators at recruitment phase, and 87% were male with age 45. It's average age, or median age, sorry. Oh, it's the mean age. Okay, the mean age. You can edit that out. I'll try that again. We screened for 984 insulators at the recruitment phase and found that 87% of the insulators were male, while their average age was 45. And 454 insulators were followed up after a median interval of 3 years. We followed them using 2 questionnaires that were structured and validated to acquire information including demographic profile, family history, and occupational exposures to asbestos and other insulating materials. All participants underwent comprehensive pulmonary function tests, including spirometry, whole body plethysmography, and diffusion capacity of carbon monoxide in the lungs. And the reference values for spirometry were calculated from the Canadian cohort of obstructive lung diseases, also known as CANCOLD. The participants were assessed clinically and radiologically, so we also collected X-rays from each of the participants. And ARLDs were defined as the presence of any condition such as atelectasis, pleural thickening, asbestos pleurisy, pleural plaques, pleural calcification, or asbestosis. We carried out statistical analysis using bivariate analyses to test the relationship between each of the occupational exposures and ARLDs and each of the exposures and covariates. The association between occupational exposure to different materials and ARLDs was assessed using a modified mixed effects Poisson regression models, adjusting for potential confounders such as age, sex, and years of work. We also tested the effect modification by potential factors such as smoking, body mass index, chest infection, childhood exposure to smoke, parental lung diseases, and family history of cancer. So here you can see in our results the demographic characteristics in all our participants. The average age is shown as 45. In visit 2, the average age went up to 50. Gender was predominantly male at both visits. BMI was fairly consistent between the 2 visits at 29.2 to 29.7. A good percentage of the insulators were active smokers at about 32 to 31%. Years in insulating work were between 16 to 21 years. And we also found a significant proportion of them experiencing chest infections at 48% for visit 1 and 38% for visit 2. Smoke exposure and childhood, parents with a lung disease and cancer in the family were also indicated, at least for the visit 1. So here you can see the difference in lung functions at baseline and follow-up visits. We found there was no difference across the board for all the different parameters of lung function, FEV1, FVC, TLC, DLCO/VA. The prevalence of ARLDs, however, at baseline and follow-up visits actually increased between the 2 visits. So you can see there's almost or almost 12% of the participants were showing signs of ALDs, compared with about 8% at visit 1. And then we looked at the frequency percent exposure to baseline and follow-up visits for individual components of the insulation material. So these are individual materials. We saw aerogel showed an increased frequency of exposure, and asbestos was correlated with that at visit 2. And this followed with calcium silicate with the greatest increase, together with mineral fiber. However, with carbon fiber, we saw there was only a slight increase. In fiberglass, there was a small increase, and there was a larger increase with refractory ceramic fiber in exposures. So this is probably the most important observation in our poster at the association between occupational exposure to different insulating materials and AOLDs. If you look at this panel here, you can see that AOLDs, the relative risk of having AOLDs showed a decrease for aerogel, but a significant increase for asbestos. When we looked at calcium silicate, carbon fiber, mineral fiber, there was no difference. However, with fiberglass and refractory fibers, we could see that there was an increased relative risk of developing AOLDs. This is a single exposure regression, so it's an unadjusted model. If we then adjust for the single exposure regression, we found that there was no significant difference between all of the different materials except for the refractory ceramic fiber, which showed a significantly elevated relative risk of developing AOLDs. And then when we did a multi-exposure model, we found the same result for specifically refractory ceramic fiber. So our findings show that insulators occupationally exposed to refractory ceramic fiber are at an increased risk of developing AOLDs and suggest multiple causes of AOLDs beyond asbestos exposure. This association is not modified by smoking, obesity, chest infection, childhood exposure to smoke, parental lung diseases, or family history of cancer. And I would like to acknowledge grants from the Wellness of Workers Program and the Local 110 Heat and Frost Insulators and Allied Workers and Synergy Respiratory Care for the work that was done in this project. Thank you for your attention.